And are we live and ready to go?
We are live, Mr. Premier. Please start.
Very much. Well, good afternoon, everyone. I'm joined as always by Dr. Morrison. I'll begin by saying that the COVID-19 situation, specifically around the new variant Omicron, is evolving rapidly across the world and across the country and across our region. And over the last few days, we have seen a spike in cases here in Prince Edward Island, and that news continues today. I know that Islanders are tired. I know that Dr. Morrison and the team at CPHO and all of the healthcare workers in our province are tired, and that as a society, we are frustrated that after 22 months that we are still living within a pandemic. And I can tell you quite honestly that today we have news to deliver that isn't easy to deliver, and we know that it isn't easy for Islanders to hear some of this. But with the recent rise in cases here and in our neighboring provinces, we must take further action that has proven to keep us safe in the past, and in order to prevent further spread in our province and to protect our healthcare system and our society in general. Dr. Morrison will provide an update on these new restrictions shortly, but I want to reassure Islanders that these decisions are not taken lightly. These are challenging decisions to make, but in the end, they are necessary to keep our province safe, and that is what we have done through the 22 months of this pandemic, and we will continue to do so. I want to remind Islanders that we continue to have the strongest border measures in the country, that we have one of the highest uptakes in vaccination rates in the country, but we cannot rely on that alone. And if we can slow our interactions, we can slow the spread of this virus and this new variant. And that is what we are trying to prevent today with the measures that we're going to be announcing. And last but not least, I say it again, and I beg those, if you haven't gotten vaccinated, please do so. If you're eligible for a booster shot, please get it. We know that vaccinations are the best way to prevent serious illness, hospitalizations, and helps hopefully to reduce the spread of this variant. We need to do everything we can do to keep this province safe. We have a good track record, and we need that to continue. This is a very, very difficult time that we are in, and it requires us to dig in and meet this moment one more time. So with that, I will turn it over to Dr. Morrison to provide a more thorough update, and then we will both be answering some questions from our friends in the media following. So over to you, Dr. Morrison.
Thank you, Premier. Good afternoon, and thank you for being here with us. As the Premier mentioned, we'll give a little update on our situation here and talk about some of the new measures in place that will be put in place to help deal with the exponential spread of COVID-19 in PEI and the potential impacts on our healthcare system and the province in general. It is, frankly, it's disheartening and disappointing that we have to put additional measures in place to slow the spread of Omicron variant. The speed at which this variant is spreading is unparalleled and unprecedented in this pandemic. We do have to go back to the basics and continue as we have during the last 22 months, focus on protecting ourselves and others and protecting our health system. We have access to the tools that we need to fight against this variant. Wearing a high-quality mask, getting vaccinated, including a booster when eligible, maintaining physical distancing from people outside your household, washing hands often, and staying home from work, school, and other events and activities when we are not feeling well. There are 31 new cases of COVID-19 to report in PEI today, bringing our total number of active cases to 75 and 475 since the pandemic began. This is a record high number of cases for PEI. I do not have all the details collected on these cases due to the volume of cases coming in and activity in the office, and they will be provided as they become available. While Delta took over as the dominant variant beginning earlier in the summer, we fully expect Omicron will quickly overtake Delta in the coming days. We do have a second case of confirmed Omicron variant to report today. This case was announced previously and is a link to the outbreak at St. Evax. The majority of our recent cases are linked to travel, either directly or indirectly. Some are close contacts of previous cases, and for others, there is no link to travel or other cases, meaning there is community spread. Given the volume of new cases, we will have to adjust how we conduct contact tracing. We will focus on making initial contact with new cases and close contacts to provide isolation and testing instructions. We may have to forgo comprehensive contact tracing and assume there is widespread community transmission at some point, and we will be updating and reporting on these changes next week. During the past few days, we have seen COVID spread very quickly and in some instances with very little contact. While we are currently having a tough time with COVID, it is clear the road ahead of us over the next few weeks is going to be very rough. Like other provinces, we are in for a very challenging time with great potential to strain all aspects of our healthcare system and to disrupt the province in general. We know the Omicron variant is highly transmissible, and like other provinces, we are seeing cases rise quickly with a doubling rate of about 2.5 days. Many people infected with Omicron are symptomatic, and it is too early to tell if we are going to see higher levels of hospitalizations and ICU admissions. The high degree of transmissibility leads to a much higher risk of large outbreaks. We have to anticipate that Omicron will create significant strain on the healthcare system and public health system, both of which are already fragile. While we know the vaccine provides less protection against Omicron, it appears to provide protection against severe illness and hospitalization. And this protection is enhanced when individuals receive their third dose booster when eligible. We need to take quick and decisive action now to allow us time to learn more about the Omicron variant over the next few weeks. Specifically, we need to reduce our number of close contacts by at least 50%. We need more children aged 5 to 11 immunized. We need more people who are eligible to get their third dose of vaccine. And we need to stress the requirement for people from different households to remain physically distant. On Tuesday, I announced new interim measures aimed at mitigating the spread of the Omicron variant and indicated these measures would be adjusted if necessary based on new information. We are now making some of these adjustments to these measures. We've had a record number of cases in the last 3 days, 52 cases in the last 3 days in PEI. New Brunswick and Nova Scotia are seeing record high case numbers. We are seeing case numbers that we have not experienced at any point during the pandemic. Modeling in other provinces suggests that healthcare systems, including critical care capacity, could be overwhelmed in the next few weeks. This variant is moving faster than any jurisdiction can react. We need to do everything we can to slow down the spread of Omicron. And we know from the experience in other jurisdictions that every day matters. With Omicron cases doubling every 2 to 3 days, the sooner we take steps to limit contacts and protect islanders, especially those who are vulnerable to severe outcomes, the sooner we will mitigate transmission of this virus in some settings, and the sooner we will limit the impact of this wave on individuals, families, and the province as a whole. We will not be able to stop Omicron or prevent its impacts. However, we must take steps now to slow the rapid spread of this variant. And I need to be clear, I do not feel like we are going to get our arms around it like we have previously. We will not stop it, but if we can slow it down while we get more people boosted with vaccine, more children vaccinated, and learn more about the virulence of this strain and the potential impact on the healthcare system, that is what we are going to try to do. The following additional measures come into effect tomorrow morning, December 18th, at 8 a.m. for a 3-week period until January 8th, 2022. Personal gatherings are limited to 10 people plus your household members. In order to decrease the number of contacts, you should have a steady 10 people, not a different 10 people each day. Visitation in long-term care and community care is being adjusted to protect our loved ones who are vulnerable to severe outcomes from COVID-19. Visitors will be limited to 3 partners in care plus 3 designated visitors with physical distancing. Facility operators will be asked to continue to screen visitors and ensure access to hand sanitization, supplies, and masks. As well, strict physical distancing between people from different households is required for all organizations, events, venues, businesses, and organized gatherings. Physical distancing is now going to be a legal requirement, not just a recommendation, in all venues up to a maximum of 50% capacity in retail businesses and VaxPass events, including theaters, gyms, community gatherings, casinos, etc. Public venues are responsible to put measures in place to remind patrons of the requirement to maintain physical distancing, including signage and floor markers and monitoring capacity limits to support distancing. Restaurants and eating establishments must maintain 6 feet between tables and continue to require proof of vaccine for patrons. Masking is required by all patrons except when actively eating or drinking. The maximum table size in an eating establishment will be 10 people. There is to be no dancing at any event, and karaoke is not permitted. All indoor sport and recreational activities are paused for island children under the age of 12, and this includes all organized sports, tournaments, competitions, games, team training, and practices. And although we had wanted to have play and practices continue for those over the age of 12 years, at this point in time, with this rapidly increasing number of cases today, we are also going to pause those activities for the 12 to 18 years of age as well. Employers are asked to support employees to work from home when it is operationally possible. Church services can proceed as planned during the Christmas season, respecting masking, cohorting, and physical distancing requirements. As the Premier mentioned, these are not the messages we want to be delivering. And while we have been successful at containing COVID-19 to date, we will not be able to contain the spread of the Omicron variant in the same way. I urge all island residents to limit their contacts by at least 50% starting today. If you are questioning if you should host or attend an event or activity, the best decision is likely not to attend. The situation with this variant is evolving. It is important that we continue to monitor the emerging science and epidemiology associated with it. Our risk assessment will need to change as new information becomes available. As I've mentioned before, we all have to take responsibility for our own actions and decisions and do our own personal risk assessment. Assessing your own level of risk when deciding to attend personal gatherings with people outside our household. We need to think about our own vaccine status and status of others, our own health and the health of others we'll be interacting with. And we need to consider our risk of severe outcomes related to COVID-19. And we need to consider the type of activity we are going to engage in. So I'd like to reinforce 3 messages. If you're eligible to be immunized or eligible for a booster 6 months after your last dose, please book an appointment online or call the vaccine booking line. Reduce your contacts by 50% and be intentional and purposeful about doing so. Respect public health basics, including wearing a mask, physical distance, get tested if you are symptomatic, and stay home if you're not feeling well. And as we adjust to yet another phase of this pandemic, I've said it before, it is more important than ever for all of us to be patient and kind to each other and to ourselves. And we'll open it up for questions for the Premier and for me. Maybe we'll start, Premier, with those in the room. So I don't mind whoever would like to start.
I guess Dr. Morrison. Hi, Dave Stewart from The Guardian. Thank you as always for taking your questions. I guess the first one is we are right at the ramp-up point for Christmas and the holiday season. People are going to malls, church services, midnight masses. The kids are off school as of today, I believe. What do you say to Islanders that as we're hitting sort of the highway at this point, that it seems like a sudden stop? It feels like we're right back to square one.
Well, I know the Premier may jump in here too, and I think we both had some of that same feeling as well. I think what is different in that we're not back to square one is that we know more than we did when we started this pandemic. We know that masking and physical distancing really important. We now know that we have more people vaccinated, which decreases the risk. So we have more tools. And this is a time with this sort of unparalleled variant that we use all those tools to try to protect ourselves and minimize this transmission that is really galloping ahead of us. So it does mean we when we do go to the mall or to the church service, it is that important that we have our masks on and we maintain physical distancing if you're attending. It's going to be really important to do that in the days ahead. And what we're seeing here is certainly not unique. As has been pointed out, it's happening in all our other provinces around us and across the country and across the world. And we are still learning about this variant. And at some point, we are going to be making a transition to more people getting infected, but really wanting to focus on minimizing the severe outcomes like hospitalizations and how we can manage and decrease the impact on the system in that way. Premier, please feel free to jump in on any of these.
Yeah, I would just echo, hi, David. Certainly, it's a difficult time for everybody. I mean, we're exhausted from this. We're tired of it. We want so badly to be through it, but the reality is we aren't. We've had these stops and starts before. This one is probably more sudden and more, more broad, a little bit more broad than we would ever have thought. We're just trying our best to react to the realities of this variant, how contagious it is. When you look at the numbers that we just have here, it should give every Islander an indication of just how contagious this is. We have been very, very fortunate to up until now that we haven't had a whole lot of hospitalizations or worse, but just the sheer law of average and the volume of numbers, indicates to us that that has potential to change, and that is why we're trying to do everything we can. And we just ask for Islanders to continue to be understanding and to be thoughtful of themselves, their family, their community, and their province.
I guess the follow-up question is basically, did I understand it correctly that the venues, everything is basically cut down, restricted to but half capacity? And
for some, it's really the important part is physical distancing for those without, outside your household, and really up to 50%. And for most people, that's about 50% capacity. But for the markers that used to be on the floors to try to, space people out, I think we need to think about some of those same kind of measures. In addition to being masked and our vaccines. So that's, and those, I realize that although the order needs to go into effect, because obviously we can't wait to act because every day is important. We understand that businesses and organizations and facilities are going to need to take a couple of days to adjust to this. That is absolutely totally understandable, but I think they'll need to understand why we're doing this. It's to protect the people that are using, the patrons that are using their businesses and facilities.
Is this what you expected?
I mean, I think the Omicron has come really throughout the world really quickly. And, a week ago, there was discussion of whether we could, could we limit some of its importation into the country? We know that the federal government has issued a travel advisory against international travel, just because of the risk of importation. What I didn't talk about here, and I think it's really important, and I want Islanders to certainly hear this. We talked about it on Tuesday, but I'd like to emphasize it again, that we are seeing people who test negative on their point of entry, and an increasing number in the last few days are positive on their day 4. So I talked earlier in the week about enhanced precautions in those first 4 days. And it is so important. So masking, physical distancing, as much as, and minimizing going out to organized gatherings and in some other sort of higher risk settings until you get at least that second negative test is really going to be important. It's not isolation. It is enhanced precautions during that period of time. And if I was to use an example, if I knew there was someone who had arrived in PEI or returned to PEI, I would wait until they got their second negative test before they came over to the house to visit with my family. I have 2 children that aren't fully vaccinated, and a mother who doesn't have her booster yet, and so I would want to make sure. So all of us who are either having family come home or visitors or returning from travel, we should pay extra caution until you have that second negative test. And we're seeing it just, a lot of people are symptomatic. And so don't wait until day 4. If you're symptomatic on day 2, go get tested. And how key that is. So that's not a change from Tuesday, but I need to emphasize that as we go into the holidays.
And Dave, just to add to that, I mean, that's exactly why I'm joining today by phone. I mean, having been in Washington, D.C., arrived early this morning, was tested at the bridge, and it was negative, but just trying to be extra careful and through that abundance of caution, wait to get a 4-day test to make sure that things are where they need to be. And I think that's just part of the reality of where we're at here right now, and certainly had taken Dr. Morrison's advice to heart, and have been working from home since we arrived early this morning.
Great.
Brittany Spencer with CBC. Now, you did mention that Islanders should expect more cases. Today, a record number of new cases announced. I'm just wondering, what is your outlook for the next few days? What should Islanders prepare themselves for in terms of how many cases we could see?
Brittany, I think we anticipate more, as we're just seeing them come in faster than we can really even call people. So I do think we'll have a lot more cases in the next few days, and it's really hard because it's not only affecting obviously the people who are ill, but other close contacts as we go into this holiday season. I'm concerned about outbreaks in facilities, and we know that with those who are immunocompromised, those who have underlying health conditions, who are older, it's really 50 and older, tend to have the more severe outcomes. It is a concern. I think it's also speaks to our concern around making sure healthcare workers, frontline healthcare workers, and essential workers also get their booster dose when eligible, because we will need to make sure that they are able to continue to work, and looking at almost test in place. So if at some point we have so many healthcare workers impacted or who are supposed to be in isolation, we'll still need them to work. So how do we make sure we use appropriate PPE and test them frequently enough so that they can actually work? So these are big changes for all of us, but we're looking ahead of what that could mean in the weeks ahead.
I know in Ontario, the interval or the time frame between that second dose and the booster dose was shortened to 3 months. Is that something PEI is looking at this point?
We are aware that Ontario went and changed that booster recommendation, but we are and have really tried to follow the NACI and National Advisory Committee on Immunization recommendation, remembering that the immunity wanes over a period of time, and we want to enhance that, but we also want to do it in a way that will keep people's protection. So the longer we can sort of have that interval before boostering, it's that important point where we can then make sure people are protected over the months that lie ahead, and that's going to be important for the population. So I think you'll see most provinces certainly stay with close to the 6-month interval, and that's based on the evidence and the science out of our expert body about vaccines. So at this point, that's where we are. But a reminder, we have over 8,000 people as of today who are eligible for boosters, and they have not been boosted yet.
And now you mentioned that the new measures announced today, they will be in place until January 8th. I'm wondering if there's been any, if we can anticipate any new measures for schools, or if there's been any discussion at this point about schools.
Premier, do you want to answer that?
Yeah, sure. Well, I could begin, and then Dr. Morrison, maybe you could add. But obviously, school ends today, and we'll be out for 2.5 weeks. Our bulk is scheduled to go back in on the 4th. As it stands today, I wouldn't anticipate, because of the order we're putting in till January 8th, that students and teachers would go back on January 4th. But we've asked the Department of Education and their early learning to go back and talk to all of their partners. Early learning is a big component of this as well. So just want them to take some time over the next few days to determine what's the best plan for them moving forward. But we certainly don't anticipate, knowing what we know right now and having the measures in place until January 8th at a minimum, that our students would go back to school on January 4th right now. And we will have a further announcement in the days ahead of how that will look on the school calendar.
And I wanted to just ask about other places. So there are measures in place for businesses and retail spaces. I'm just wondering about other places like gyms, movie theaters, places with high touch surfaces. Can we anticipate any sort of further measures for those types of places?
Well, I mean, I think, again, it's sort of back to the basics. Those entertainment venues like movie theaters, it's really a 50% capacity in many instances, or physical distancing between households, and the masking and hand washing, very important. So wanting some of these things to still be able to operate, but doing so, making it as safe for those who are going to be there to still watch a movie.
Sorry, just one final question. I'm just wondering, on Tuesday, your recommendation for traveling off island was to limit travel unless necessary. I'm just wondering if that is where your recommendation lies today as well.
So, and the Premier may jump in here too. I mean, I think we're seeing Omicron variant numbers of cases increase in many parts of the country and outside the country. We have been advising to limit travel, but understanding that for many people, they haven't seen family or friends at the holiday season for a long time. If someone chooses to travel, making sure they are careful and cautious, and if they come back, very much follow our guidance around making that really enhanced precautions for those first 4 days. Children for school, daycare, post-secondary, and work where possible should not go back until they've had a second negative test. And that's really what we said, and that will be important for those who have traveled or returning, coming here or returning from travel.
Thank you.
Thank you.
Gabrielle Drummond, Radio Canada. Bonjour, Dr. Morrison. Alors, ma question, ça va être en français. Tout d'abord, est-ce que vous pouvez, s'il vous plaît, nous expliquer pourquoi vous mettez en place ces nouvelles mesures en ce moment-ci?
Bonjour, Gabrielle. C'est vraiment, on voit une augmentation tellement vite des cas de COVID et puis avec Omicron ici à l'île Prince-Édouard, mais aussi autour de nous. Et alors, on met ces mesures en place d'essayer de ralentir un peu le nombre de cas qui arrivent tellement vite, diminuer le grand nombre. Chaque jour, on veut ralentir tout ça pour avoir plus de temps qu'on peut savoir plus à propos de Omicron, qu'on peut avoir plus de temps pour faire les boosters pour vaccins pour les personnes qui ont besoin, plus de temps pour vacciner les enfants. Alors, on sait qu'on ne va pas éliminer Omicron, mais on veut ralentir pour préserver et protéger vraiment notre système de santé.
Okay, très bien. Vous avez dit que la distance physique à compter de demain, ça devient une exigence légale, si j'ai bien compris. Est-ce que vous pouvez nous expliquer qu'est-ce que ça veut dire exactement, cette exigence légale? Est-ce qu'il va y avoir des amendes pour les citoyens, pour les établissements? Est-ce que vous pouvez nous en parler un peu plus?
Alors, on vient d'annoncer mardi vraiment qu'on voulait que vraiment on a la distance physique quand vous allez quelque part au resto, entre les tables, même vraiment au business où on va faire les achats. Et maintenant, c'est vraiment, on met en place parce que je pense pas que peut-être tout le monde comprenait que c'est tellement important. On sait que les masques sont importants, les vaccins sont importants, mais quand même, la distance physique est très importante. Alors, si j'étais quelque part et je ne connais pas les personnes autour de moi, je garderais mon masque, je garderais la distance entre moi et quelqu'un d'autre. Et puis, faire ça autant que possible. Et si j'étais peut-être plus vieille ou j'avais des conditions médicales, je peut-être resterais chez moi pour un bout de temps, juste pour me mettre pas à quelque place avec plus de risques et plus de transmission.
Donc, quand vous dites exigence légale, il n'y aurait pas des amendes ou même de la surveillance qu'on ferait pour voir si on respecte la distance physique, que ce soit dans des établissements comme des restaurants, ce genre de choses. Donc, il n'y aurait pas des amendes qui seraient imposées aux gens si on ne respecte pas la distance physique.
Alors, ça peut arriver, les amendes. Et puis, on sait que depuis la pandémie, on a toujours des personnes qui... et puis, des fois, ça va sur au cours, système judiciaire. Alors, ça peut être... C'est difficile des fois si quelqu'un appelle pour dire... il y avait une personne là qui n'était pas en distance physique, mais si quelqu'un est à propos d'un d'un établissement, et puis s'ils ne font pas la distance physique, on peut investiguer et puis on peut faire un amende si on a besoin.
OK, très bien. L'autre question, ce serait par rapport à l'intervalle concernant la troisième dose. Vous avez répondu en anglais tout à l'heure, mais j'aimerais l'entendre en français, s'il vous plaît. Alors, on sait qu'il y a certaines provinces qui essayent de réduire l'intervalle entre la deuxième et la troisième dose pour qu'on ait plus de gens qui vont avoir leur booster plus rapidement. Pourquoi l'île du Prince-Édouard ne va pas pour l'instant réduire cet intervalle-là entre la deuxième et la troisième dose?
Alors, c'est l'île du Prince-Édouard, à ce moment, à l'instant, on ne va pas réduire l'intervalle de 6 mois entre la deuxième dose et la troisième dose. On va suivre vraiment les recommandations des experts nationaux, NACI, National Advisory Committee on Immunization. Et puis, ils regardent l'évidence, la science, et si si ça change, on va aussi changer, mais à ce moment, ils vont quand même rester à 6 mois, et c'est tellement important pour ceux qui sont 50 ans et plus, les personnes qui travaillent système santé et d'autres groupes, mais comme exemple, ils doivent être vaccinés quand c'est leur tour à 6 mois. On veut que ça protège les gens aussi au niveau population pour le plus long terme aussi, que ça dure pour les mois qui suivent.
Et ma toute dernière question, c'est quel est votre message pour les insulaires qui nous écoutent, qui vous écoutent présentement? À quoi vous vous attendez dans les prochains jours pour ce qui est du nombre de cas? Peut-être qu'il y a des gens aussi qui sont très inquiets en ce moment-ci en vous écoutant. Quel est votre message pour rassurer ces gens-là?
Pour rassurer, alors je comprends, je suis aussi inquiète. Quand on voit le nombre qui augmente comme ça, et je ne veux pas que les personnes deviennent tellement malades qu'ils vont à l'hôpital ou ils ont les outcomes qui sont plus sévères. Alors, tout ça m'inquiète. Mais alors, pour rassurer les gens, c'est vraiment que on fait toutes ces choses. On met les masques, les bons masques. On garde la distance. Et puis, on sait qu'on a fait ça avant. Et puis, ensemble, on a travaillé ensemble pour diminuer le risque depuis 22 mois. Alors, je suis rassurée que les insulaires ici vont faire ça encore une fois. Et j'espère pour la dernière fois. Et qu'on va... on va arriver à un moment donné alors qu'on est sur l'autre côté.
Très bien. Merci beaucoup. Bonne journée.
Bonne journée.
Mike Tutton, Canadian Press.
Doctor and Premier, as particularly Dr. Morrison makes so clear, we don't know very much yet about Omicron. With all of these measures and so on, I understand you want to slow things down, but how quickly do you think you'll be reassessing to look at the downside of keeping the old policies and old approaches in place. For example, isolation and the periods of isolation. Will you fairly shortly be revisiting that? Because if it turns out that you're causing more health concerns by isolating health workers for long periods of time, then the Omicron variant is actually causing in terms of people's health issues. Recognizing you have a difficult balancing act, this is my question for you. How will you balance this, especially with isolation going forward? How quickly will you be revisiting everything you're saying here?
Hi, well, I'll start. I think, first of all, I mean, the isolation, I think, of cases and their close contacts may be what you're referring to. And as I mentioned, I think in response to either in the notes or to another question, it's we're actually making some deliberate planning and transition with that in mind. So, and I know it's happening across the country as well. Can we minimize the period of isolation of close contacts, and in one case and also cases? Can we do a different plan for healthcare workers who are close contacts so that we can test them, for instance, every day using a combination of rapid antigen tests and PCR tests to make sure that they can continue to work in the healthcare system? So we're making some it's not even something where we need to revisit. We are actually planning ahead to that transition where we are learning to live with COVID. And we've talked about this at length throughout the pandemic. And really, this wave and this Omicron variant is going to quickly make us very carefully and deliberately makes decisions about how we transition to live with COVID, and that includes looking at the shortest amount of isolation period for the minimal number of people that we have to in order to protect those who are vulnerable, and if we can do so using other testing measures, especially for our frontline healthcare workers and other essential services in the weeks ahead.
Yeah, Michael, I would just add. Oh, sorry. I would just add. Sorry, Michael. That we know that this is not healthy from a variant perspective or from a mental health perspective, having to do all of this. So, we obviously revisit these things each and every day. We don't want to be in this situation any longer than we have to. I think that's the frustration. The point of your question, I think, it symbolizes what most people are thinking and feeling is that, how do we ever get out of this? And it's a question that we talk about each and every day. But we do revisit this on a daily basis. And these are short-term measures. We hope they can be as short as possible. And we're just trying to use the best science and best data we have to get through it. And it's tough for everybody, but certainly respect the premise of the question.
What is your ICU capacity and hospitalization capacity before you have to start moving people off the island?
So we have, I don't have in front of me the number of ICU beds, but we certainly can provide that. But we certainly know one of the reasons we have worked so hard, and I know we've the Premier has spoken about it, we've been very fortunate, but we've been also, we've worked very hard in order to be fortunate to protect our health system right throughout this pandemic. In the last 22 months, we had one person who was in ICU in terms of a hospital admission, but no other strain on the ICU capacity previously. But we don't have a large ICU capacity in this province in general, and so that's why it's been so important that we put measures in place to try to prevent people from having severe outcomes, ending up in hospital or in the ICU. But we can certainly provide you those other numbers later today.
Yeah, and Michael, just to follow up on Dr. Morrison, I mean, we obviously have a limited capacity due to our size, and some of our sister provinces who help us with other parts of our healthcare are also at risk of being overwhelmed very, very quickly. So it is just a case of take one from PEI and put it elsewhere, because what we're seeing in the rising increase in numbers and the fear that that could have in various healthcare systems is there may not be opportunities for them to go elsewhere simply because of the potential volume of this. So that's why we're trying to act as quickly as we can and to try to get ahead of this as much as we can. Heather or Dr. Morrison said right off the top that we can't stop this, but we have to try to get in front of this and to delay it as much as we can.
Thank you, Premier. Nova Scotia today has announced that it's canceling surgeries, elective surgeries, again, out of fear of a lot of health workers being isolated, being in isolation, therefore not available, rather than actual Omicron. And I'm just wondering, how many days do you think before the island is also bringing in measures to cancel elective surgeries, make sure beds stay open, that sort of thing, because of a shortage of workers?
Well, I think the part of the answer to the question is really what I just said, is that we're going to be making decisions very quickly on basically a test to stay direction, which would allow in as safe a way possible to, if needed, if we ever got into that position in the next week or two, that we'd have some policies and some direction around testing our healthcare workers so that they, who are close contacts, and if we needed to. Okay, is that? Premier, did you have anything else to add before we?
No, I would only add to that Health PEI goes through a very, diligent process to make sure they have plans and processes available based on the assumption of risk, et cetera. We would be dealing with the senior leadership at Health PEI, it has been and will continue in the days ahead to make sure we try to plan for as many of these potential situations that may arise, but also hold out the great hope that our efforts here will lessen the need for us to take any drastic measures, but we just have to react and try to get ahead of this as quickly as we can.
Yeah. Well, I agree. So thank you, Premier. Thank you, everyone.